Hello and welcome to our presentation on Florida Occupational Therapy, Supervision and Delegation. My name is Zachary Edgar and my company is called Therapy Comply. Therapy Comply is a membership-based compliance firm dedicated to physical, occupational, and speech therapy practices. Members can access our wide selection of guides and sample policies on federal and state law, along with our guides and updates on private payers. Members can also simply email us at any time with any compliance or billing questions or arrange a phone call. We also offer more comprehensive services like compliance and billing audits, custom policies and procedures, and credentialing. This presentation is for informational purposes only. None of the material is intended as legal advice. Statutes and regulations are all subject to change. The OT shall interpret referrals or prescriptions for occupational therapy services, perform evaluative procedures, and develop, plan, adjust, or modify treatment procedures. Supervision means responsible supervision and control, with the licensed OT providing both initial direction in developing a plan of treatment and periodic inspection of the actual implementation of the plan. Such plan of treatment shall not be altered by the OTA without prior consultation with and the approval of the supervising OT. The supervising OT need not always be physically present or on the premises when the OTA is performing services. However, except in cases of emergency, supervision shall require the availability of the supervising OT for consultation with and direction of the supervised OTA. As of now, Medicare requires that therapists in private practice or employed by a physician group be on site when an assistant is treating a patient. The 2025 proposed physician fee schedule will change that rule to general supervision so that therapists can be off-site when assistants are treating patients. The therapist will need to be available by phone. For states with more restrictive supervision levels, such as direct supervision, those therapy services are always furnished to the extent that is permitted under state law. And if it's required that you be on site by state law, you will still need to be on site when treating a Medicare patient. Most payers and state Medicaid programs defer to the state's physical or occupational therapy board rules for the supervision of assistants, but may require more frequent reassessments. TRICARE follows the Medicare rules and requires on-site supervision and have yet to propose a change to that rule. A licensed OT or OTA may delegate to the occupational therapy aides only specific tasks which are neither evaluative, assessive, task selective, nor recommending in nature, and only after ensuring that the aide has been appropriately trained for the performance of the task. Occupational therapy aides may perform ministerial tasks and functions without direct supervision, which shall include, but not limited to, clerical or secretarial activities, transportation of clients, preparing, maintaining, or setting up treatment equipment and work in the work area, and taking care of clients' personal needs during treatment. Occupational therapy aides shall not interpret referrals or prescriptions for occupational therapy services, perform evaluative procedures, develop, plan, adjust, or modify treatment procedures, act on behalf of the occupational therapist in any matter related to direct patient care which requires judgment or decision-making except when an emergency condition exists, act independently or without direct supervision of an OT, patient treatment, and any activities which an occupational therapy aide has not demonstrated competence in performing. All delegated patient-related tasks must be carried out under direct supervision, which means that the aide must be within the line of vision of the supervising OT or OTA. Any duties assigned to an occupational therapy aide must be determined and appropriately supervised by a licensed OT or OTA and must not exceed the level of training, knowledge, skill, and competence of the individual being supervised. The licensed OT or OTA is totally and wholly responsible for the acts or actions performed by any occupational therapy aide functioning in the occupational therapy setting. Medicare, TRICARE, and most Medicaid programs expressly state not to bill for the services of aides. Most private payers state that services must be performed by a licensed therapist or an assistant under their supervision. Do not bill for services provided by aides unless the payer guide expressly allows you to. I've never seen a payer allow billing for aide services and really would recommend never doing it. Thank you for watching, and please visit the website for a lot more comprehensive information on physical, occupational, and speech therapy compliance and billing. Please like and subscribe. We'll be adding many more videos soon.